Welcome, everyone. Thank you for joining today's webinar, Solve Together, a walkthrough from a patient's perspective with my Data Helps platform architect and our friend, Chris Nowak.
Welcome, everyone. Really excited to share Solve Together with you. So this is Chris. I would like to introduce him as our Solve Together hero. We are so lucky to have him. He's a lead architect for Care Evolution, who created My Data Helps. And My Data Helps is the hosting platform for Solve Together, and it's used by a lot of organizations. And I hope as we name these organizations, the NIH, the All of Us study, that someday people will be saying, oh, it's used by Solve Together, because I think that's how amazing this platform is. And we're really lucky to have Chris here today to show it to us. This is me. I'm an epidemiologist and I do research. And I came to Solve when we had the U plus Me platform. So I became very familiar with that platform, as well as concerns or suggestions people had, patients in particular, about that platform. And so had the opportunity to help in the transition, not only talking to patients, but also incorporating some of the feedback we had gotten over those years. All right, so why Solve Together? There are so many whys about this platform, and I'm going to start with the why and get to the what. But it's a way of empowering you with your own data. There will be tools within the platform you'll see today that help you organize and act on your health information. Burden is not the why. Getting rid of burden would have been a better bullet to put here. But one of the most common forms of feedback we got about the U plus Me platform is this is an amazing platform, both for researchers and for patients. But I have ME/CFS, I have long COVID, and my energy reserves are really finite. And you're asking a lot. Is there a way that I can participate but not fill out all these questions? And this is somewhat of an answer to that question, with the opportunity always to get more data at a later time, but to touch lightly initially on participants. And then I'll talk a little bit more about our vision of Solve as a catalyst for research. And then, what exactly is Solve Together? It's an online platform you can access by mobile, desktop web, iOS, or Android, and you'll see some of that today. And it's also a research study. It's a research study where the data from ME/CFS and long COVID can be shared with researchers. And it's also an opportunity to participate in other research studies that will be hosted by the Solve Together platform. My slide is stuck. Here we go. Great. Who can join? Anyone over 18 in the United States, and that means ME/CFS patients, long COVID patients, and healthy controls. And we love healthy controls. So this is a tell your friend opportunity, because your friend over 18 residing in the US is eligible and welcome into Solve Together. You'll learn how to join in this webinar. There'll be many opportunities, and it only takes a few minutes, so you can set it up even as we're going through it today. We're excited for so many reasons. I talked about a catalyst, and this is the vision. It's something that provokes or speeds change or action, at least in chemistry. And we think of that in terms of research for Solve Together. We heard about the burden that was U plus Me, and yet we knew that the information we were collecting was so essential. And that information is still maintained. We still have it. We still use it. And we can link it to your Solve Together record. And yet, as you move to the Solve Together platform, you will notice that there is less asking for a variety of reasons, because we can collect data in real time if we need to. A new vaccine comes out, we can pop up that questionnaire. But also because we can collect data in passive ways by integrating your data on the platform where you answer questions to data that you opt to link, say, to your wearable activity tracker or your electronic health record. So today we'll get to look at the features, and the features that we'll be looking at are wearables and activity tracking. Then we'll be moving, this is not quite ordered the right way, but then we'll be moving to pacing and notifications of pacing, symptom logging, surveys, electronic health records, And we will show you during this how you can participate in external clinical studies that are hosted by the Solve Together platform through notifications within the platform. So we'll start by showing you what it looks like if it's all set up. If you're somebody who's been collecting data on the platform for some time, you'll see what that looks like. But we'll also look back and show you how to sign up if you're not already registered. And if you already are, we think the first part of this demo will still add great value and show you some features you may not already be aware of. Here are the questions we got before, and I'm just going to tell you where to look for the answers and briefly discuss each. So one of the lovely things about Solve Together is you don't have to go in a certain order. You get to choose your own adventure. If you are someone who wants to participate in clinical studies, you'll see the baseline surveys as Chris goes through the demo. And once you complete those, that's how we select people, or at least find who's eligible and can qualify for certain clinical studies. So that might be a place to start if that's your interest. Are we interested in the anecdotal information? How much is freeform? We are so interested in that. And you will see a narrative part of the demo. And you also see in symptom tracking how you can really freeform what is meaningful to you. When clinical trials become available, how do you find them? Well, if you have filled out your baseline surveys and we find that you might be eligible, we'll send you an email from the Solve Together system, and you'll be able to find the surveys on the survey page if the surveys are linked to that clinical study. And will this incorporate heart rate variability, blood pressure, heart rate, these sorts of things that can now be tracked at home? And the answer is yes, depending on the type of wearable you connect to the platform. I have a note here. Inevitably, we won't cover it all, and I'm already talking faster than I probably should because I'm so excited to show you what we can, but we'll show you a lot. This is how to join. And Chris will also have this up during his presentation. Feedback is welcome. There is a place on Solve Together where you can offer feedback to us, and we do see that feedback and we do welcome it. So any feedback you have for us, we'd love to hear it. And with that, I'm going to stop my share and turn it over to Chris. Chris is going to be walking us through. So you can see.
All right.
Yeah, go ahead, Chris.
No, go ahead, please.
Chris has the Solve Together platform up on his phone, and you can see the first thing that kind of draws my eyes in here is Chris's activity. He has been tracking activity. What you can see right now is 30-day average activity. So this is kind of how his activity is over the course of time. You can also look at activity on a daily level and really drill down into what those activities are. So one of the really nice things is the ability to have a visual display of data. And here's that 30-day average. And that's today. Actually, I may have been mixing that up when I was looking at the other form. Did I do that, Chris? Did I mix up daily and 30-day?
Yeah. So I think this activity today here at the top is showing you what is how are you doing relative how are you doing today relative to how you normally are. And this is one of the ways that we tailored the experience of Solve Together to try to take into account ME/CFS and long COVID patients. I know a lot of folks with ME/CFS and long COVID use activity trackers to count how many steps they're doing or what their heart rate is today. And this is a nice at-a-glance view to say, hey, am I taking more steps than normal today? Or active, how active have I been today so far? And I've got my Fitbit hooked up to this already. And so you can see my active minutes have been counting up today. I haven't been particularly active today, but this is my real data, for instance, from my Fitbit. And so we hope that this kind of visualization would be useful. And as we go down, we can actually drill in and view more activity data. And this is where you can kind of go back in time and see, well, how have I been doing over time, as opposed to just today. I can see, how was my steps and sleep and activity on, say Sunday of this week. I only got 6 hours and 39 minutes, and that was kind of below my average that day, for instance.
Thanks, Chris. Yeah, and you might be wondering, what the why of this is, and there's a few whys to collect this type of data. One is that you don't have to work to collect it. You can opt in or out, but if you opt in, it goes on in the background. And whenever you sync your device, then the data comes in. There can be a delay depending on how much you're syncing that device, but it will be here for you. And another why is what's a unique hallmark of ME/CFS and long COVID is something called post-exertional malaise. And the idea is that there is a disproportionate response into exerting oneself that can lead to a crash. And that crash can be putting someone out for hours or days. And that's why Chris has moved to show you pacing notifications, because that's a really lovely and really disease-specific feature of this platform. And many people have found that pacing, sort of getting an alert when you're getting towards some sort of actual exertion level, whether you want to set that as number of steps. If you have Apple Health, it could be, a very specific heart rate. I have the Fitbit, and so for mine, I have a Fitbit has various zones, and when I go into a zone, it will push through, and I think, yeah, there are the notifications, and it says things like this to kind of give you a heads up. Again, there can be some delay into syncing and until when the data are received, but you will get these notifications when the data are received to give you a sense of where you are in your day, and to allow pacing, which many patients have noted is very helpful to them.
Yeah, I think this is mostly, the same kind of data is available in the app if you go to the home screen or go to the activity tab. But of course, by getting a notification about it, you don't have to open the app and check. You just kind of get pinged, hey, your steps are, you've walked 75% of the steps that you normally walk each day. Should you, and it's up to you completely, of course. It's just information, whether you want to take that information and then and do something with it or ignore it. But of course, these are totally optional in the app. They currently work with Apple Health and Fitbit. And you can receive these notifications via either SMS text or push notification if you have the native iOS or Android app installed.
Yeah, and Chris, you bring up a good point. I didn't mention what activity trackers can be linked to Solve Together. Anything that you can link into the Apple Health or Google Health platforms can link to Solve Together, and that could be something like a Withings. I can't remember all their names, but they're Garmin, Fitbit. So there are a variety of these that can feed into the platform.
Yeah, I have my Oura Ring as well today, and so that's another one that works through Apple Health, and so there's a wide variety of different devices that work.
Great. Should we show symptom logging?
Yeah.
All right. We're going to move to symptom logging, and this is a lovely feature. I think it's a lovely feature for a variety of reasons. One is just being able to track your own patterns. And the second, which we'll show you, is the ability to make a report and share that with your doctor. And so with that, I will turn it over and we can watch Chris get into symptom logging and add symptoms. So you click there. Yeah, go ahead.
I think one other thing just to mention about it too is, it's a completely optional component, just like everything else in Solve Together. It's one of those things that we hope is useful to you as a tool, but isn't something that you're obligated to do on a daily basis or anything. Just like everything else, I think, in Solve Together.
True, it's all choose your own adventure. And
Yeah.
this one you can set to do as often or as infrequently as you like. Chris is going ahead and he's selecting various symptoms. You may notice on here, what I really like about it is hot shower is a great example. These are not generic symptoms or treatments that, there it goes, even though I turned off my phone. How do I stop it? I'm going to mute myself while I deal with
Well, maybe I can continue. So I've oh, okay, yeah.
No, you would do. Oh, there goes the other phone. Okay, Chris, go for it.
No, I think mine is also going off here, just on do not disturb. So I've gone ahead and actually logged some symptoms for today. It's a daily log of symptoms, and you'll see as we get into maybe some of the setup how you can actually customize what symptoms you want to track and what treatments you want to track. It's completely customizable to your particular journey. So I think as one of the questions asked, how much do we want anecdotal information or information that's personal to you? I think this is entirely it's meant to be your symptom log about how you are feeling, and whether you want to call it brain fog or something else about what you're experiencing, that's totally up to you. And maybe the next part is showing what you can do with the data that's actually, after you enter all of this data. I don't know, Leslie, you can take it away.
Absolutely. So yeah, the customization is, in what you're going to track, and also what you want to report on and what you want to share. You can see all these beautiful little colorful dots on Chris's screen, and you might be thinking those don't make any sense to me, and they shouldn't make sense to you. They should make sense to Chris, just like your own symptom tracker should make sense to you, because Chris has set this up. And you can see a little bit more detail at the bottom with color coding. And then he can get a snapshot view of how he was on a given day. And then he can look across the calendar and start to think about patterns he might be having. You can also see down below is the frequency. Oh, no, this is great too. So you can just see the frequency that feeds into that. This is other really nice view. This is about fatigue levels. And so you can see the number of days that Chris experienced severe, moderate, or mild fatigue. And then down below, you get a time shot of when those days occurred. And you also get these averages. So, every day can be different, but on average, what's an average day look like, which can be helpful information as well. And here's another view of it. Over time, daily overall experience, again, you'll see the average in the upper right-hand corner of that graph. And I really think that symptom logging has a variety of great options. You can look by month, something that you might show. You can kind of look over time. So now we're looking in the future, October. I guess that's the present now, and you could go back in time. But I think you have the opportunity not only to collect and observe your own patterns, but I think it's hard when you go to the doctor and the doctor says, well, how many days did you experience that headache? Or how often did you take that ibuprofen? And so this is a way to report out on that in ways you want to report. So if you're going to a pain specialist, for instance, who may be mostly focused on the pain symptom, then you could filter by that symptom and bring that in with your report. So Chris is probably going to show you, are you going to show a report and how to create a report? And this is amazing. It's a PDF. And so you can create a PDF report, send it to yourself, or even send it directly to your doctor. And Chris is going to do that now.
Yeah, so it's really straightforward to create a report. Now that I've got all that data in there, I can choose, what do I want to include symptoms or treatments on that report? What month do I want that report to be on? If I'm going to a particular specialist, as Leslie pointed out, I might choose certain symptoms that I only want to include on there. But in this case, I'll just include everything and hit create PDF report. And while this is generating, you'll see there's a button in the upper right. And once this report finishes generating, I can just tap that button, which is the share button, and I can share this report, which has it's a full page report, has my symptoms and what days I was experiencing them, my levels of severity of my different symptoms over time, and how I was doing overall. And I can just tap that share button and share it over email or SMS or however you want to send that file to yourself or, your doctor or caregiver or whoever else you want to share that with.
Great. Thanks so much, Chris. I love that snapshot of all the data in one place. And now Chris is going to go back to home and from home show you some surveys.
Yeah.
So I talked a little bit about if you want to be part of clinical studies, where you should start, and that might be here with the baseline surveys. And we have a number of baseline surveys divided into two categories. One category is surveys we will take over time. So the cadence for those surveys would be an annual update once a year. And the second category are one-time surveys. So things that aren't expected to change substantially over time, and we would just collect once at baseline. You'll notice that for each of the surveys, you've got sort of a stoplight effort. An effort is amount of time on the survey, but also how physically taxing, cognitively taxing that survey can be. And when Chris clicks into one of the surveys, you can get some more detail on this. So when you click into any given surveys, it gives you an estimate of how long it will take to actually do that survey. What types of questions you'll be asked, and perhaps most importantly, why we're asking these questions. One of the nice things you can see as Chris starts the survey is that this one's 3 minutes, but that may be too much in a given day or maybe a longer survey. And so you have the option always it's at the cancel button. When you hit cancel, you have the option to truly cancel, say, discard this, I want to start over, or to save it for later. And if Chris were to save it for later, and did you do that? Yeah, you see it now, the linking information and the illness history both say resume so that he can go back in and finish the survey when he's feeling up to it. So the number of surveys we have here is 13, and they don't need to be all filled out at once, and some are just a point in time. For those of you who are part of You Plus Me, all that data is maintained, and these data are recollected as part of an update. And we think that you will find that it is less taxing than You Plus Me, but we also want you to know that we can link this to your You Plus Me to get a full picture for all the data you've provided. Anything else you want to add about surveys, Chris?
I think just one other thing I wanted to mention, again, there was a question earlier about whether we wanted narrative or anecdotal data. And indeed, that's actually a feature that was directly built in from the beginning, is we want to know broadly about your experience with various things. So your life before illness, getting diagnosed, and COVID-19 are 3 topics, for instance, we asked directly about, where we just kind of want to get a sense of, what was your life before, ME/CFS and long COVID, for instance. So
thanks for pointing out. That's a really great point. We do have a lot of narrative options, and they're sort of marked as such, as you can see from the surveys page. And for the next part of the demo, which is the EHR, we've mostly gone in and shown you data that's already populated. But because the EHR is not a common feature of other surveys you might do, or it might be considered something that you want to learn how to connect, we want to show you how to connect it. And you can see what happens when you try to connect an electronic health record. You get the same type of explanation as before. What are we asking? How is it helpful? And then why are we doing this? You might be asking, these are really very private data for most people. And so I think that it's helpful to explain why we're asking for them and why it could be helpful if you opt to share. And as we've said many times, it's choose your own adventure. So please only share at your comfort level. But if you share, we have a lot of information that we would not have otherwise, whether it's a blood test or imaging or doctor's diagnoses, and going back historically over time. So there's a lot of advantages to that aspect of this that we think are really helpful. I'll also add that we don't know what we don't know. So, ME, CFS, and long COVID are frustrating in the sense that we don't know what the right biomarker is. We don't know what the right treatment is. And there might be data in here that help us answer those questions, that we can detect patterns if we see it, if that signal is going off from multiple electronic health records. And so with that, I will let Chris show you how to get started.
Yeah, so one thing I guess I want to point out from a basic level, when we're talking about health records here, I mean, I think this probably most people know this, but your insurance plan, whatever insurance plan you happen to have, and your hospital and your doctor, all of course have data on you. And it's actually your right by under US law to be able to request that data and give it to, say, Solve Together. And there's actually, and you can do that just within the app. You don't need to call them up or do anything fancy. And that's kind of what we'll show you here, is there's actually two options for how you can do that in the app. For those of you who are using an iPhone, you can connect using Apple Health Records if you already have that set up on your phone, if you're familiar with that. But if you're not on an iPhone, or if you don't have that set up, you don't need to worry about it necessarily. You can just directly go in here under search providers and health plans and search for your provider. So I'm going to start and search for, say, my health system. We're going to say that's Cedars-Sinai Health System, and I'll show you how I'm connecting to Cedars-Sinai here.
One of the things we got an advanced question, not specifically related to this webinar, but in general, is can you connect multiple health records? And the answer is yes, and Chris will show that as well. But he's going to start with Cedars-Sinai. And the login Chris will enter here is the same login you would enter if you were on Cedars-Sinai's or your insurer's or your provider's site. It's the same username and password.
And
go ahead.
I was going to say, yeah, and of course, all of this is done with your consent, and it'll tell you what information you're sharing and how that data will be treated. And so I'm just going to continue and approve sharing my data. And go ahead, Leslie.
Yeah, so this is the screen where you can decide what you want to share and what you don't want to share. We find all of it helpful, but we also want you to know that there should be full transparency on what you're sharing. And you'll see later when Chris kind of takes you back to the health records, the health and wellness dashboard, that you can really see that all in one snapshot. But the two things to note on this screen is that you can check what you want to share and for how long you share it. You note that the maximum amount of time you can share is a year. And yes, we'll be coming back in a year and asking if you are willing to continue to share it.
Yeah, and that actually does depend on your hospital. It could be, I know my hospital allows 5 years, for instance. And so, the maximum amount of time, of course, is great if you are willing to share that, of course. So I'm going to choose a year here, though, for Cedars-Sinai.
Great. Thanks for that clarification.
So I've connected one, and now I'll just go ahead and connect another provider here really quick. Let's just pretend this is my my doctor's office, for instance, versus maybe my hospital.
And as Chris logs in here, those data will be populating into a dashboard once he's connected. And again, he's using his usual login that he would use with this particular doctor's office or portal. And so as those data populate, then Chris can go ahead and take us to the dashboard, but we might be a little early for that.
Yeah, the one last thing I wanted to point out is you can link more than just your hospital or doctor's office. What also, has a bunch of valuable information that we would love for you to share is information from your health plan. So for instance, you can connect to Medicare if you happen to have Medicare insurance, Cigna, Humana, and Anthem, and so all of these insurance plans are available to be connected to as well.
Excellent.
And so now I can actually go and view the data that has been connected here.
I love this screen for a variety of reasons. I will name three. One is it's a great snapshot, just kind of everything in one place. The second is for transparency. We want you to be aware of what you're sharing, and here is an opportunity to see it. The third is you will see in some places there is a circle with an eye, and thinking, oh, well, what is this thing that I'm learning about? What's a WBC? And this is linking to the National Library of Medicine to give you some information about exactly what that particular lab or test, et cetera, is. And so it's just a really enriching way to look at your medical information. And there are opportunities within here to search things, and it can get very granular and deep. And you know, if you want to find a particular lab, et cetera, if you're going to the doctor and they want to know what your last XXX CBC count was, you can bring that in, and maybe that saves you another stick or something like that.
I think the other thing I just want to point out here is we really, with Solve Together, you're sharing data for research. So we really want to be transparent about what data that you're sharing. And so this view gives you a sense of, okay, I've connected my health records to Solve Together, and this is the information that I'm sharing for research. And of course, I can also browse it and use it for my own benefit.
Great. Anything else on EHR before we show how to join Solve Together?
I think that's it.
All right. So now Chris is going to show you how you would join.
Yeah, so Solve Together is, we've had this up on screen the entire time of, and so of course you all here can join either by scanning this QR code or visiting the website. Again, this Solve Together is available. Sorry, I'm gonna quickly bring up the website on my phone here too. I can drag these windows around. So available to join on, just on your desktop computer or on your mobile web phone. On the Solve ME website, there's a big button here at the top, so really easy to find. But I'll show kind of going through it on my phone in the mobile web browser here, just to stick with that. And so I'll just scroll down here and select Join Solve Together today. And as Leslie mentioned, only available currently to people who are over 18 in the United States. But really outside of that, even if you don't have any CFS or long COVID, you can join. Still, healthy controls are welcome to participate in Solve Together. And go ahead.
Yeah, no, please. Okay, I was just going to point out, I thought you were maybe going to the next screen, that you see mydatahelps.org at the bottom of Chris's screen here. And we've gotten questions about what's My Data Helps, what's Solve Together. And I just wanted to, and am I in the right place? Did my link lead me astray? And the answer is that My Data Helps is the platform created by amazing architects like Chris, on which Solve Together sits on and is hosted. And so that's the difference between Solve Together and My Data Helps.
And just going through this process, we've already covered, I think, a lot of all these things, of course. And on privacy, of course, as Leslie pointed out, you're sharing really private information and sensitive information with us when you join this program. So, we of course take the absolute utmost precautions and to keep all of that information private. The system that this is built on, the My Data Helps platform, goes through rigorous security testing and is used by the NIH for many programs and is approved by the NIH, for instance. And you don't have to participate and you can leave whenever you want, although of course we'd hope that you would stick around and in the platform for quite a while. And of course, Solve Together is a research study. So in order to participate, you do have to consent to participate in research. And this is kind of the full consent document, and we would of course recommend that you review this before agreeing to participate. But I don't think there's anything particularly surprising that we haven't covered, I guess. But of course, would recommend you review it. And I'll just go through this quickly and select agree and provide a quick electronic signature. And I don't know, Leslie, if you want to talk about this one, or yeah.
Yeah, I love this. Yeah, you might be contacted about future research studies. You can always say no to those as well. But this is the part where if you fill out the baseline surveys and a researcher comes to us and says, you know, I need saliva to help find this biomarker, or I would like to enroll patients and controls in this particular trial, we would reach out to you through the Solve Together system, which has email enabled, and you would be able to opt in or out of a given research study. And of course, to opt in or out, we need a lot more information about that study, which we would provide at that time. And then if the study involves a survey, when you're in your home screen and you go to surveys, then you would be able to fill out that survey.
And then finally, as Leslie mentioned, this is on the My Data Helps platform. So the next step of kind of finishing this out is to create your account. And so once I hit next here, I'll be prompted to enter my email address. So I'll just use I'll enter my email and create a password. Oh, my screen share died. Sorry, 1 second. All right. And I can learn a little bit more about My Data Helps. And then once I get through that, I will be in Solve Together. And the first thing it'll say is, hey, it'll give you a link to download the app. We do recommend downloading the app because it makes it a little bit easier to use the symptom log. But again, it's totally optional. You can still do everything in the mobile web environment outside of, say, things with Apple Health. And so in this case, I'll just select not now, and I won't download the app at this moment. And so here we are in Solve Together. So that was really the sign up process. And maybe the other thing that we've been through, I think, a lot of these features like baseline surveys, but maybe one thing to show real quick is how to connect a wearable. We showed, what it looks like when a wearable is connected, but connecting a wearable is really straightforward as well. And Leslie, I don't know if you want to provide any context about like why wearables are important, like why, I think we covered it a little bit, but
Yeah, no, there was actually a question we got in advance about, and I forgot to cover that as we were covering wearables. So I think this is a great opportunity for that. Can you collect things like heart rate or heart rate variability? So the answer is yes, but why would you want to collect it was Chris's question. So because we're trying to learn more about ME/CFS and long COVID. So for instance, looking at heart rate variability and understanding that better in patients with ME/CFS has been linked to some things like autonomic dysfunction. So if we're able to collect those data using your wearable, we might be able to compare your heart rate variability to that of if you're control to that of patients, to if you're patients to that of controls, and note those differences and really try to determine, is this hypothesis correct? And then if we see this pattern, okay, well, why are those differences? And sort of, all those steps in research and the scientific process that lead us to conclusions that can further diagnostics and therapeutics, something so desperately needed in these diseases. And yet I think so hard to get because people who have ME/CFS, people with ME/CFS and long COVID experience fatigue and experience crashes. And so being able to offer those data on a regular basis can be very difficult. And the Fitbit or the Oura Ring allows someone to do that in a passive manner.
So here I can really quickly, it's really similar to connecting your electronic health records. So, but there's a number of different ways to connect devices. I think we've mentioned, Apple Health, Google Fit, Garmin, but here I'll just go ahead and connect my Fitbit. That's that I've got on my wrist here. And I'll just tap the button and I just have to enter, what my Fitbit email address, Fitbit account information, basically. Email address and password, and sign in. And that's it. Now I've connected my Fitbit and it's downloading data. And in a few minutes, I'll start to see the activity stuff that we had showed earlier populate on my home screen and things of that nature. Let's see. But while that's happening, maybe we could actually show how to set up the symptom log here. So, after I've connected the wearable, I can see this tile start to show up of start your symptom log. And again, if this is, we hope this is a useful feature to you, but, I know daily logging can be a lot for a lot of people. So if it's too much burden-wise, it's certainly not required, like everything else in Solve Together. So, but getting started, you just tap the button and it'll, and, you can actually go in, we've started with a few symptoms that are relatively common for ME/CFS and long COVID. But as we mentioned before, this is really your symptom log. So if you say aren't experiencing racing heart as a symptom, you could just say, hey, I'm going to delete that symptom. I don't want to see that as one of my options. But maybe I do experience migraines. So I can go ahead and add that as a symptom. And I can also choose, well, maybe I'll call it migraine. I can also choose how I want to track the severity for that. So I can choose, maybe I want to track it as a 1 to 10 scale or a mild, moderate, severe rating. And what color, how I want to color code migraine for when I look at it on the calendar. I can choose what treatments I want to track. And these can really be anything. These can be literally anything that you use to track your symptoms that you might want to, or that to treat your symptoms that you might want to track over time. My wife, for instance, uses a Cephally device to treat her migraines. And so that's one of the ones that she has tracked in here whenever she uses that. And finally, you can set up reminders for your symptom log. These are, and choose which time of day that you want to be reminded for, logging your symptoms. So let's say I want to get notified, right before I go to bed at, 9:30, and then I can actually set up a second reminder as well if I want. And so now you can see my Fitbit data is coming in, and I can see now at the top, I have that button to log my symptoms today. I can tap that and you'll see, my migraine symptom that I put in here is in here. I can choose to track my other symptoms today, what treatments I performed and how I'm feeling overall, and any notes that I might want to enter. And that data then, of course, starts to show up on the calendar, and you can use the symptom reports and everything else.
Thanks so much, Chris. So I will pause here, Chris, to see if there's anything we left off the demo that you want to share, and then I'll pull up a screen where people still have the joining QR code, and we can answer some questions.
Yeah, the only other thing I wanted to mention is, so at this point in, Solve Together is all set up, and the one thing that of course, the whole goal of Solve Together is to build a big patient community and a big data set with a lot of different patients and healthy controls. So with that, we of course would really appreciate it and love it if you went in here and you know, there's an option to invite a friend. You can just pretty easily tap the invite a friend button, enter their email address, and it'll send them an email inviting them to join. And as Leslie, I think, mentioned at the beginning of the presentation as well, also very grateful for any feedback that you have about the experience or any questions that you have. And there's a way in the app here under more at the bottom to share your feedback about the Solve Together experience.
And thanks to those of you who have already submitted feedback. We do review those, and they're incredibly helpful.
I think that's it.
All right. So I guess we can just leave up your Join Solve Together while we answer questions. That's just as good as mine. Wait, oh, okay. So actually, before this one question will have us somebody's asking about kind of the patterns and how to find that screen where you can look at patterns. I'm guessing this is within the symptom tracker, and we did go fast. And so why don't we review that again a little bit more slowly?
Yeah, so under there's two maybe ways to look at patterns. If you want to look at patterns for your symptom log data, there's the calendar tab at the bottom. It's the third tab here, and that's where you can kind of see your symptom log patterns. The activity data was down here. Once you've linked a wearable, you can start to see there's if you scroll down on the home screen, there's a heading called My Data, and looking at View Activity Data, that's where you can kind of see your various wearable data patterns.
Thanks. I'm an epidemiologist, so obviously I love patterns, but I think this is a really great opportunity to track them. So thanks for showing that again. We are, I'm just going to put out there that if we don't get to all the questions as I'm looking at them, I think that might be likely, that you can continue with any questions you don't get answered today, either through feedback on the app. That's probably not the best way. The best way would be to do research and then solvecfs.org. Those questions go to the research team, and the research team will be answering those questions through email if we get them through email. If you leave a phone number, they might call you back as well. So we appreciate those questions. Great. So there were a few questions about international participants. Of course, someone is coming to my door right now, and I'm going to ignore them, but I'm sorry if you hear the knocking. So there are a few questions about international participants that need to be answered here. We said only residing in the US. That is the case now. The wonderful thing about Solve Together is it is a tool that can grow and change, but right now it's US residents only. And so what can you do if you are not residing in the US? I think that it is the case that you can still go to other aspects of My Data Helps through a web interface. And Chris, maybe you could talk a little bit about that. And in specific countries, this should be part of our FAQ page where you can actually get the app as well.
Yeah, well, I think Solve Together, the research aspect of it, being able to participate in research, is not available in outside of the US, and I think that's due to regulatory reasons and how, you know, and for how research is performed. Carevolution does offer the My Data Helps app itself in other countries, and in particular, if you wanted to use the symptom log independent of using Solve Together, if you just like the symptom log tool here and you just wanted to use that and you happen to not be in the US, there is you can visit symptomshark.org, and that's one way to get access to just the symptom log. And that's available in certain countries. I don't have, unfortunately, the list in front of me at the moment, but yeah, it is available in the UK at least. Yeah.
There's another question about, I did find my provider of insurance there. And so I think it might be helpful to clarify kind of the 3 ways to get at pulling in electronic health information. So could be your insurer, could be the hospital or clinic you visit the Cleveland Clinic, so you could search on that, or individual providers. So for most people, if you have electronic health record that you're viewing, that you could be able to pull it in through Solve Together. I'm sure there are exceptions, but I wanted to point out that all 3 are worth searching on, not just focusing on an insurer or, for instance, the clinic where you get your care. Anything you want to add to that, Chris?
No, I think that makes sense, and I think it's also good feedback if you do have a provider that you can't find. Maybe that's feedback that we would encourage. That we would encourage you to share in the app as well, sharing what that provider is. At Care Evolution, we are constantly adding more providers and searching for more providers, and sometimes there isn't a centralized list of those, and so we do rely on patients telling us in some cases, like, what that, hey, I can't find my provider, and can you add them? Because a lot of the times we can find them and add them to the app.
Great. There's a really interesting question about putting information, say, about treatments or symptoms into the app and machine learning. And the app doesn't have machine learning in it, but would this be an opportunity to export those data if somebody wanted to pull them into a language model or something to have that look at their data? Is that possible?
I think it's yeah, I don't know that I have a good answer at the top, off the top of my head. I think we've explored some options like that, and we're looking into some of those things, but at the moment, I think a lot of it is mostly looking at patterns and being able to share them with your doctor, versus maybe the app telling you, hey, this treatment and this symptom go together, because we don't want to draw any. We want to allow your doctors to kind of provide their insight as well into that equation, if that makes sense. Yeah.
It does make sense. And I will say also on our end, on the research end, we will be looking at those patterns. We won't be saying to you, Jane Doe, we saw this pattern, but we'll be looking at patterns at a population level and using those data like that.
Yeah.
And I wanted to make sure there are several questions about privacy, and if somebody shares their EHR and then wants to revoke consent, how do they do that? What happens to those data? Can you share some more information about that with us?
Yes. So right in here, under your Connect Health records, you can go into your providers and health plans that, I've connected 2 of them, and you can just go ahead and disconnect that data. Of course, if data has been already used for research, a lot of the time it can't be removed from downstream databases. So if it's been exported to, Solve ME and already used in a research study or publication, for instance, that data can't be removed from that, of course, because it might already be a published, paper or data set or something of that nature. So.
But it can be removed going forward. So
yes,
the next
time,
you can
always, yes.
Yeah, data are downloaded, your data would not be included and would not be part of an analysis data set. And I think it's also important to point out that when we analyze data, we are looking at the population and never individuals or things that could identify someone.
Yes. There was a question I noticed about Quest Diagnostics. And I believe that, there isn't a way to connect directly to Quest Diagnostics in the search bar here, But if you do happen to have an iPhone, and I know not everyone does, but I think this is the only way currently. Quest Diagnostics does connect to Apple Health Records. And so if you were to connect them through Apple Health Records and then hit the Share Apple Health Records button, that you would then be able to share that data with us.
Another question about can you use the whole platform from a mobile browser? I know you can certainly use it from within your phone in an app and a laptop, but also the mobile browser.
Yes. So so here I'm in the app and I can actually just switch. And here I'm in the mobile web browser, and you can see it's pretty much the same experience. It also works fine on a desktop browser as well.
Great. There's a question about disability insurance. I'm not sure in what respect that was asked, but if, say, for someone is applying for disability, I think that the nice thing about Solve Together is that if I needed information as part of that application process, you would have a lot of it in one place.
Yeah, I think the question may have been, can the disability insurance companies access the information? And we just want to be clear, when you connect an EHR or an insurance plan, they will not be able to see the data that you enter into Solve Together. The data that you enter into Solve Together, only SolveME would be able to use that for research purposes, but like your insurance company would not be able to, they would not see your symptoms, for instance, if you connect to them in this app. It's only a one-way connection.
Right. So similarly, yeah, as you choose to share anything with us, that connection is, we can't get into your medical record unless you share those parts of your medical record.
Correct.
Well, we're at time, so I want to thank everyone for coming today and encourage you to get on Solve Together. If you are on Solve Together, to give us feedback, to ask questions, and to remember that research at email address so that we can get to all those questions. And a very special thanks to Chris, who joined us, who not only is the brain behind everything you saw today, but so seamlessly walked us through it. Thank you so much.